Well, hi. Didn't see you there. But now that you're here, let's talk about somatoform disorders. I'm Gregamusu.
I'm Sam Bashke.
And I'm Hannah Paulson.
Somatoform disorders are categorized in 5 different groups. The broad definition for somatoform disorders is anxiety that results from stress and is displayed as physical symptoms. The 5 different types are as follows. Pain disorder is when your pain is so intense that it will affect your daily life, but your pain isn't conscientiously faked. It's unconscious and you can't control it. In body dysmorphic disorder, the physical symptoms stem from a misconception or an obsession with a physical defect. Hypochondriasis is when a patient fears that their oftentimes imagined symptoms are indicators of a more serious illness. Somatization disorder is characterized by many complaints over a long period of time, which often leads to the impaired social lives of patients. And finally, conversion disorder involves symptoms that can change into other physical manifestations. History and background. Since the 19th century, workers who've been trying to identify more about this disease have found that these patients with somatoform disorders, are very easy to hypnotize, and this goes back to the fact that they're suggestible. Their physical symptoms are suggested by their mental inclination to believe that they have them, and so they have more suggestibility and can be easily hypnotized. One of the types of somatoform disorders that we talked about was the conversion disorder, and this disorder inspired Sigmund Freud to develop psychoanalysis. And finally, the conversion disorder used to be called hysteria. Since it is a somatoform disorder, it has unexplained symptoms, and that's where the hysteria comes from.
So the main symptoms of somatic disorders are being distressed by physical symptoms that don't have any apparent physical cause or appear to be all in the patient's head. So a person may worry excessively about certain symptoms, such as like body pain, stomach pain is common. The diagnostic criteria was changed in 2013 actually, but it involves being concerned over physical health or somatic symptoms for at least 6 months. However, the actual pain of the symptoms doesn't have to be present during the entire duration of this time, and the symptoms will generally have to disrupt daily life with at least one of the following, which would be persistent thoughts about the seriousness of the symptoms, high anxiety about the symptoms, and excessive time or energy spent thinking about the symptoms. Each of the 5 somatic symptom disorders has its own set of diagnostic criteria, so there's a link here if you want to go check those out. Otherwise, you can Google DSM-4 somatoform disorders, and it should be the first link there. So an example case was of an 11-year-old female who had a 5-year pain history, and she was diagnosed by a psychiatrist with severe fibromyalgia. And so she went through pain counseling, but her symptoms got worse and she entered a wheelchair. After that, she was entered into a collaborative care unit and was diagnosed with severe somatic pain disorder. And after the doctors looked at her history, they found that there were several psychological stressors in the months preceding her illness and believed this to be the cause of her symptoms of her condition. So after that, she underwent physical, occupational, and speech therapy until she made daily progress. She was moving better. She could do more self-care activities, and then she was discharged on day 22 because she could walk. She could, care for herself and feed herself and function normally. So the prevalence of this disease is between 0.2 and 2% of women and less than 0.2% of men. And the symptoms usually start before age 30. A lot of times it's common in adolescence, and it's far more common in women than men. However, since the criteria, like I said, was changed in 2013, there's been a lot of disagreement between professionals about which cases fall into the actual category. For instance, one study last year reported that there was a prevalence rate of 16.1%, or up to about 22% when including mild cases. So when you compare that to about, like 2% from the top of the slide, that's a really big difference. And then there's generally a higher risk for people who already suffer from personality disorders, chronic pain, and psychiatric issues such as depression. So here's a breakdown between all of the 5. If you want to pause it here and look a little bit closer, you definitely can. Otherwise, just note that most of them, 3 out of the 5, are more common in females. Otherwise, in the other 2, they are equal. Um, they show the symptoms under the age of 30 to 40 in adolescents as well. And then, low economic status and low education can or have a high correlation with these diseases.
Etiology concerns the causes of somatoform disorders, and as of now, little is known and understood about the causes of the disorders. And the theories that are out there do not differentiate between the different forms of the disorders. So the 5 forms that we talked about before are believed to all have the same root causes as of now. The hypotheses for the somatic disorder causes are as follows. There is a biological medical hypothesis that states that the cause of the disorders is a result of neurotransmitter-related activity, which occurs as a result to a high level of stress hormones. There's also a psychoanalytical approach, which concerns the Freudian approach, including using conversion as a defense mechanism, as we talked about before. And there's a cognitive behavioral explanation of the disorder, which lies in that the idea that there's situation-specific symptom expression, along with overattention to physical sensations, which emphasizes the fact that the disorder occurs as a result of situations that patients are experiencing on a regular basis. For treatment of the disorder, there are 2 sort of main branches of treatment. The first being cognitive behavioral therapy, which reduces symptoms along with any anxiety or depression. And the purpose of that is to alleviate the mental aspect of the disorder. However, it sometimes leaves patients still needing ways to cope with physical sensations, which is where psychotherapy comes in. And that helps the patient deal with chronic physical discomfort. And it also provides a way for them to manage stress associated with the pain. That concludes our presentation on somatoform disorders. Thank you for your time.
Is it done?